You're about to see 4 courageous women who we consider the unsung heroes of first responders. Oftentimes when you think about first responders, we think about the police, we think about the fire department, we think about EMTs, we see the ambulances coming down the street and we think about them. But there are so many others in our community in Charles County, Maryland, whose work really impact our lives and they make our lives better. So we're going to highlight 4 ladies. They have terrific stories. They've actually come from other countries, they uprooted their lives and they've come here. They decided that America is their home, and more importantly, and especially for us, they've decided that Charles County, Maryland is their home. And we just can't wait for you to hear what they have to say about their work, about what it took for them to move here, and how much they love this hospital that you see right here.
Greetings, ladies. My name is Samuel Peter. I'll be conducting the interview today, and this is our friend Miss Yvonne Medley, who is the founder of the Life Journey Writers Guild, which this is found doing the event. I just wanted to ask, ladies, what is your name? What is your what you do here, and of course your country of origin?
Mm-hmm. Okay.
I'm Annabelle Cobera Montinola. I'm the manager for population health, and I came from the Philippines.
Okay.
Okay.
So my name is Meeta Patel. I'm actually originally from India, and I have been in this country for 32 years. And I have worked at Charles Regional Medical Center for 21 years, and I'm a nurse, and I'm also a diabetes educator and a coordinator for the diabetes team.
Okay, that's wonderful.
Oh, wow.
That's wonderful. So, well, the next question was how long have you worked here, which you already answered. So what led you to this job, and what led you to Charles County in general?
Okay. So I first came here year 2000. I landed in New York. So I'm a New Yorker. I worked there for 5 years, and every time we came and visit here, one of my best friends in college lived here, and every time we came, everybody's just so happy compared to the people in New York. You cannot look at anyone straight in the eye in New York because you're in trouble. Here, everybody greets you, say hi. So that's why we moved here. After me and my husband got married, and then I've worked for Civista, first Civista, now Charles Regional for, I'll be here for 20 years in August.
Oh my goodness.
And I've been to different departments in the hospital.
Okay, so you love Southern Maryland.
Yes, because the people are just so welcoming. Working at Charles Regional, there's been many opportunities to work somewhere else, but you always feel being at home, the people are friendly, the patients are friendly, and you just like coming to work every day.
Okay, that's kind of the benefit of living in a rural area versus a city, a bustling city.
Yes.
Right?
Absolutely.
And me
So
too.
I just wanted to Southern Maryland. My family, my husband's family actually was already here. My husband's brothers are surgeon and there's a physician, so 2 doctors, so he wanted to be close to them, and so that's why one of the reasons why we moved here originally. And hospital is very close to my home, and of course, after becoming a nurse here, I just decided to pursue my career, and it was close to our home. That's one of the advantages. And I did have 2 kids at the hospital. So to me, it's our hospital, And of course, I have lived in this area for like 30 years. So it's become like a second home to me, even though originally I'm back from another country. But I have lived in this country as probably more than I have lived back in my, original country. So Yeah, and like Annabelle said, obviously, the hospital is very person oriented.
Yeah.
They take care of your employees. You're a part of their team. Never ever do you feel like you're on your own. So it's like a family.
Yeah. That's good.
Okay.
So going off of that, since there's a lot of talk about back home, what was the hardest and or easiest part about leaving your home, a country of origin, and coming here? Or was there even did you feel a shift at all, if anything?
Coming here, growing up, I was kind of sickly. I always had asthma attacks. So, but when I feel better, I hang out at the nurses' stations, watching the nurses. I made friends with all the nurses. So, but then all the nurses came to America. So I was always curious what they did in America, like what was it like there, why all the good nurses are coming here. So then coming here, it's very difficult because I come from a big family where there's 11 of us. I was the first to come, but now it's so much better because a lot of us are here now. So.
Okay. How do you feel about that?
So, about leaving the country, yes. My parents actually were in India at that time, so to me it was a big shift. And I came into, to be with my husband and with the family. So, it was a very loving family, and obviously it was very, smooth for me.
Yeah.
Rather than, I know some people have a rough time, but for me, I already had family here, and it was kind of going to another family, but very.
Yeah. My father had something very similar where he was grandfathered in, for lack of better words, by his brothers who were already here. So the transition was kind of easy when you have people here. So that's why I definitely understand.
Yes, when I first came here, my best friend's mom was already in New York, and they were the ones who brought me in and took care of me, showed me all about the city and all those things. So it's nice when someone's there to meet you.
Yeah, I think that works out. So, just briefly, is Maryland your first destination? Or I know you said New York. Was Maryland?
No, it was not. Actually, I lived in Philadelphia for about a year.
Philly?
Yeah.
Okay,
All
interesting. It's a long way from Philly.
Yes.
Okay.
Yeah.
So New York and Philly. Okay, so somewhat closer. than here.
And what brought you from Philly to Maryland, to Southern Maryland?
Again, my family, husband's family.
Your husband's family.
Yeah.
Okay, and you said they're surgeons?
Yeah, there is one surgeon and one internal medicine.
Oh, wow.
So his brothers. They are also employed by the hospital.
Oh,
With the
that's
hospital.
wonderful.
So is there anything about your job that maybe people have, maybe any misconceptions or misunderstandings about your job that you would love for civilians to know, and anything you want to clear up?
So I work as a population health manager, and most of the time people will say, population health? What's population health? So population health actually is every time you teach a patient about their disease, how to manage it, and then making them, having them successful with dealing with the disease. Like, for example, if the patient has diabetes and their A1C is really high, once we teach that patient all that we can teach them to manage it well, and they won't have any problems with controlling their sugar, that's actually population health. The outcome of teaching the patient how to manage that disease, that's population health. And population health is community health, it's public health, it's everything that we do to take care of ourselves better. That's what population health is. So it's education is key, not only at school but everywhere we can teach a patient or a friend or anyone who wants to learn about different diseases. understand it, learn it, and teach it. That's very good.
Thank you.
So pretty much Annabelle explained it very well. Their diabetes team is on the population health. So absolutely wonderful. The wonderful work that is being done. We of course do it in the hospital, and we also go out to events, at community events, and actually we try to help people out who don't have insurance or underinsured, to provide them education free of cost. And also we do community events, and a lot of we go to senior centers, schools. So people love it because they get to know about it, because a lot of people might not know. Sometimes they don't even know where the hospital is. So us going out actually opens up that door to the community that, okay, they're here. If I need help or my family needs help, I know where to go and where I can get help.
I definitely, one of the things that we try to emphasize is the importance of education, but again, not just school education. It's about what of the people of Charles County and the departments of Charles County, how can they talk to others, the civilians, about their job and the importance of it, because sometimes we just see things. Everyone's like, go to the hospital when you need something. It's like, what does that entail? Who's helping you behind the scenes? Who's doing all the work? We don't really know these things. We just expect to get quality service the minute we walk in. We don't know what goes behind that, and who the people are and what they're doing. So, is there anything that has stood out in your time doing what you do? Is there anything that stood out as a memory that we burned in your mind, or ingrained in your mind? It could be anything. It could be good. It could be bad. Is there something that's just stood out to you?
I've been around the hospital with different roles, and working as a case manager in the ED really opened my eyes to homeless people.
Okay, and tell us what DED is.
Oh, the
We don't
emergency
know.
room.
Say
So
that again.
It's the ED is the emergency room.
Oh,
Emergency department. That's why it's called ED. Homeless individuals, sometimes when it's winter time, they hang out in the ED because it's nice and warm. And we did have one homeless person that was living in a hotel before, but her mom was helping her pay, but her mom died, so she was on the streets, and she had mental issues, so she wouldn't even see a psychiatrist because she won't trust anyone. And building that relationship with her, we were able to take her to a primary care, and the primary care connected her to a mental health provider, and eventually she got supported housing. So those kinds of things you'll never forget, I guess.
Oh yeah, it must be very rewarding as well.
Yes.
And so it sounds like also you're not only teaching, treating people who are sick or have a condition, but preventive measures. You're
Yes.
teaching people preventive measures.
Yes. And here in Charles Regional, we have a very good partnership with the Department of Health, the Department of Social Services. We do meet monthly to talk about different patients, and we also love to educate the community. Partnership.
Okay. So me too. Is there something that Samuel said that sticks in your mind? An example?
Absolutely. We have a lot of patients who, of course, come for diabetes education, and some of them are in a condition where they're like, I really need help now. One such instance was we had a patient who was admitted to the hospital. We have nurses who help them in the hospital before they get discharged home. And then the patient went home, and then, he went to the pharmacy, picked up all his insulin, his medications and everything, and then he panicked. And he's like, what do? I don't know. This stuff is different from what you showed me in the hospital. I don't know what to do. So he called one of our transition nurses, and the nurse was actually, able to call me and say, hey, can you help, this gentleman? He really needs help. We are like, yeah, let's get him in. So we got him in on the same day, and he came in. we taught him how to do, you know, his insulin, his medication. It was, and education, and diabetes education, which actually, you know, he was a paralegal, and he said it changed his life. You know,
Wow.
and his, like Annabelle mentioned, his A1C was really high, and he was able to bring it down within like a couple months to a much better number. And you know, so this is helping people, of course, you know, decrease complications in their life, because diabetes can lead to a lot of complications. It's a chronic condition which affects, you know, a lot of people have, you know, chronic problems with that. So this was wonderful, and there's so many instances where, you know, we have so many examples. Of course, we don't have enough time to for that, but
Yeah.
it was amazing. That was one of the success stories that, you know, sticks in my mind.
That's amazing. Well, I just want to thank you so much for your time. Thank you so much for your service. And on behalf of Charles County, we just want to say we appreciate
Yes.
you, and we thank you. And we hopefully that more people will take your job with the same seriousness and with the same appreciation as
Yeah.
everyone else should.
You know, before we wrap up, I would like to know, what did you bring here from your culture? What are we benefiting from your culture or from your perspective?
As a Filipino, we are close. We have close family ties, and we always take care of our elderly. So, like, we want to bring that here also. Like, you need to take care of your family. When you go older, when your parents grow old, that doesn't mean nursing home. There are other ways to take care of family members at home. So it's good to plan ahead for those. And aside from that, the food, the pancit and the lumpia.
Oh yes. What about you?
So pretty much the same as Annabelle, family orientation, of course. You know, care about family. It starts at home. And that's what you carry along that with your work. You know, and when you take care of patients, talk to patients, or even team members or your, you know, people you know, I think Indian people, I don't know if I'm biased or not, but I think they have a very caring attitude and a serving attitude. You know, so I think the combination helps, and people feel it when we touch base with the patients. They feel that caring and the love, and they see that we're not just doing it for the job, but we're doing it with a purpose, with a passion.
Yeah, that's something. That's
Thank
wonderful.
you for your time.
Yeah,
Thank
we
you.
appreciate it. That's so wonderful.
Very
We're glad you're here. We're glad this is your home, right? And we are benefiting from you being here, and the love and the care and the education and the passion that you have for healthcare and community. That's
Thank you very
wonderful.
much.
Thank you.
you for having us.
You know, what's your name? What do you do here? And where is the country that you came from?
Okay, I am Evangeline Kemuel, and I'm a medical technologist, but now they call it medical laboratory scientist.
Oh,
And I came from the Philippines.
okay.
Okay, my name is Merlita Maxake, and I'm a medical laboratory scientist and also a histology supervisor.
Oh,
Came from the Philippines too.
wonderful. Okay, you didn't bring any food?
The pancit and the egg roll, yes.
Don't worry, I'm free for dinner tonight.
Yeah.
So I just want to ask, how long have you been in the United States? Also, how long have you worked in your specific offices?
Okay, prior to coming here, I worked like 11 years in the Philippines as a medical laboratory scientist.
Okay.
And I'm proud to be the first group, one of the first group that Charles Regional sponsored. We're actually the experimental. We're 3 people, and I'm part of it. That was like 21 years ago.
Oh,
Yes,
okay.
and after 2 or 3 years, they've sponsored more and more people.
Yeah.
Oh, wonderful.
So I'm the first group. I'm the
Oh,
first group.
wonderful, historic.
Yeah.
So when you say sponsored, explain that, what that means.
Okay, when they had like an opportunity to get people coming from a different country
Mm-hmm.
to to work as professionals here when they were
Mm-hmm.
needy, when they were in need of people
yes.
to work.
Yes.
So I was lucky enough to be chosen
Mm-hmm.
to come here.
Mm-hmm.
So sponsored is meaning that the hospital was the one who shouldered everything for us to come here and work.
Yes.
Okay,
Wow.
That's cool.
Yep.
Together with our families too.
Yeah.
Okay, you were sponsored as well?
Yes.
Okay.
I'm a medical laboratory scientist also in the Philippines for 19 years, working in Makati Medical Center, one of the biggest hospital in the Philippines, and then the Civista is the one who sponsored me together with my family.
Yeah.
It's
Okay.
really a blessing. It's
Yeah.
really a blessing,
So-
especially for our kids.
Mm.
Yeah.
Oh,
Yeah,
wow.
so what happened is, like, I'm the first person. I work with her
Mhm.
from the Philippines,
Yeah.
and
Oh, really?
Yes.
Oh, wow.
Yes.
So
Oh.
when they had like when they gave me an award, like Lab Professional of the Year, and they wanted more people, so I told them, I have a lot of friends from my hospital, and we share the same work ethics. Maybe you would want to interview them, and I'm sure I'm telling you they're really good.
Yeah.
So that's what happened. So it all started. I was just one of from that hospital, and now I think we're like 6, 7 people
Yes.
coming from that hospital,
Wow.
working here
From the same hospital.
from
Same
the same
hospital.
hospital. Yes.
Okay, so it's nice to have friends to help like grandfather you in. I was just saying that, when my dad came here, because he's Nigerian, when my dad came here, it was actually my uncle and my 2 uncles who actually helped him assimilate to America. So it was actually really nice to see that. So I have to ask though, now my dad, he came from Nigeria to New York, so is Maryland your first destination, or you came to somewhere else?
For us, yes.
Definitely. I
Yes.
mean, I don't have any idea at all about Maryland, but everybody has like among Filipinos, everybody has American dreams, especially if you're working in a hospital. So to tell you honestly, we are living comfortably in the Philippines, and I was just wondering what's working outside this country, and when the opportunity just landed on me, I can't just. I
Yeah.
have to grab it.
Yeah,
It
yeah.
only
Not
happens
let it
once
go
in
by.
a while, and I never, go back. I have to sacrifice everything, the comforts and everything, and I even have to sacrifice, and I think the sacrifice is worthwhile. Now I'm here, 21 years later.
Yes.
Isn't that
For
something?
me, I have my family is in California.
Oh.
My parents, my sister,
Oh,
and my
really?
father's side, everybody's there. So they're asking me, why are you going to Maryland? It's a blessing for us because you're the one who's sponsoring me together with my family.
That's good.
I came here 2007, so right now I'm going 19 years working here, and it's really a blessing. This hospital, Civista before, and Charles right now, it's really it's my second home. It's really a blessing. Daphne Gray is the one who's getting us from the Philippines through the help of Stacy Cook. So I'm always really very thankful for that. And we felt so, it's like, I felt that Daphne is my second mom here, taking care of us,
Yes.
all we
Yeah.
need,
Yeah.
everything.
Yeah,
Wow.
So
That's
when
good.
I first came here, since we're the experimental, so when I first came here, I was so amazed because people coming from different departments are going to my house and telling what do you need.
Yeah, what do you need?
Yeah,
Oh, really?
They're all. It's
Yeah.
101% support I got from
Yes.
them.
I think that is kind of the culture of Charles County,
Yeah.
of
Yes.
Southern Maryland. They
Yes.
love to
Everybody's
volunteer.
very helpful.
And just by working here and staying here for 21 years, that says something,
Yes.
right?
Yeah.
It's giving me, pushing you to give more.
Yeah.
All your, all your talent or your, you know, all the knowledge that you had before.
Yes.
Yeah, and I'm so proud. And you know, and they really would appreciate you. I have the laboratory professional of the year too, and I am a hospital champion of the hospital too.
Oh, really?
Yeah, so
Okay. And you said again, I think you said it before, how many years have you been here?
going to 19.
Okay, 19 with your whole family.
Yeah, my family follow me after 3 months because I
And
told
that's
them,
your husband and kids?
kids, two
Yeah.
kids.
Uh-huh.
Yeah, my 2 kids right now, they're finished college, working on their own. My first one is a nurse, my second one is a mechanical engineer.
Oh my gosh.
So, right? That's a big blessing.
That is.
I was about to say they're living the African dream because the only jobs you go for is doctor, lawyer, engineer, and now IT. That's it. So they're living the Nigerian dream.
Sebista is really a blessing to us.
Yeah, that's good.
Now Charles Regional.
Now, Charles,
Yeah,
right, the
Charles,
change, name
yeah.
change. Mhm.
So I know we already talked about this a little bit, but what do you love about Charles County? Is there anything that stands out here that you just gravitate toward?
For me, everybody's friendly here.
Mm-hmm.
Especially, we're going to this church, the St. Mary's, the Sacred Heart Church here. And just to let you know, we are
The choir.
part of the choir.
Oh,
made
I
a
know that
choir.
church.
Yes, so we
Yeah,
have to
every-
give back.
Yeah,
Yeah.
We
so
have
it's
to
our,
serve.
yes.
Yeah.
So what we're doing, we're scheduling every Saturday afternoon at 5 o'clock because some of the nurses cannot do it. Yeah, part of our group is nurses and medical technologists.
Oh.
And
So-
our husbands.
And our
Oh,
husbands.
okay.
And since some are working in the night shift, some are working in the morning shift, so what we did, we get the 5 o'clock on a Saturday, so everybody can participate.
Oh, that's
Oh,
Every
that's
other
wonderful.
week, we're serving in the church.
Oh,
really nice.
That's
really
wonderful.
It's for me, Charles County is like a close-knit
Mm-hmm.
county. Everybody, even though I don't know your name, but
Yes.
you know, you would feel the warmth
Yeah.
and the acceptance.
Mm-hmm. That's
different.
wonderful.
I love that. So, what did you take from your culture that you brought here? What has helped you that you've learned from back home that has really like served you really here?
I think what I brought here is resiliency.
It's
Is resiliency, you said?
Yes.
Yes.
Yes. That's the struggles, all the problems and the challenges going from a different culture, a different country, totally different.
Totally different.
And you have to bring your family with you, and I'm the only one working. So you have to be resilient, and you have to show them, we can make this. I mean, it's a sacrifice, but
Yes.
we're gonna be able to survive this. And that's what I think, the one that I brought here. So, and that's what I want to also, my son, I want my son to realize what we're sacrificing for them.
Yes. Yes. It's the same thing answer.
And also,
Yeah, but-
and also the love for your family.
Yes. For me, it's resilience because for 8 years, I'm the only one working
Wow.
because our husband not allowed to work
That's
because it's H1B, so there's
Okay.
only dependent. So I think it's the best part for us. It's a blessing that he can take care of our kids.
Mm-hmm.
You know,
Yes.
when you're asking my husband's time, it's the best time of my life.
Mm-hmm.
Taking care of the kids, you know, because you followed everything, all
Yes.
the school activities,
Yeah.
all the sports and everything. I'm the only
Wow.
one working,
Yeah.
but it's okay. So if there's an overtime, my Daphne Gray is telling me, "Do you have time to do this?" I would come up, yes, because
Wow.
I need money to support my family.
correct.
So there's a time I get 2 6 days, just the whole 2 weeks I'm trying to work, so I will have 2 extra days to
Oh.
support my families.
Mm.
Wow.
To tell you honestly, I have I just bought a house for the family back home. But when the opportunity came, I have to give it up. I want to know what's in America. So when I came here, I rented a bedroom with my husband and my son. That's the sacrifice. Yeah, and my husband has to, he has no bed. I'm just sleeping with my son, and my husband is there. That's the sacrifice.
Yes.
The irony of it. Whenever I think about all the sacrifices that I made, it's really worth it. And I would want, to share the stories, my story, being an H-1B, and I want people to be inspired because of it.
Can you describe H-1B? Can you tell me?
Well,
tell us?
H-1B is different from the other because they're gonna sponsor you to work in your in the hospital, but your dependents cannot work, and you cannot also work from with to other hospital. Only the hospital that you sponsor.
Okay.
So that's the difference.
Okay. Is that status still the way it is now for you all, or no? That's
That's
you
the
got over
good
that.
thing about it is that Charles Regional supported us from H-1B. They supported our green card, and our citizens, American citizens.
Yes.
They all the way.
Wonderful.
They supported my
blessing,
family
right?
all the way, all the way.
A blessing for us to have you.
Yes, everything.
See, hearing this, it really also inspires me too, because again, my parents are both from Nigeria, and just hearing what they have been through, and then hearing more people talking about just the sacrifices in the life. I don't know you too well, but I can appreciate it because I understand it. I get it.
Yes.
Right? And I just hope that not only your children, but everyone else understands, like, this is not just, moving down the street. This is a whole different life.
Yes.
Oh, yes.
And some
Different.
people were more successful in their in their country of origin. And then
That's
when they
right.
came here, they had to give a lot of it up. Some of them had 3 houses, had to go all the way back to living in a hotel like we did. Right? So or even a motel, or sometimes even being homeless like we did. So it was a struggle. So I really appreciate
Struggle at
it.
first.
Yeah.
At
Yes.
first.
But it's so worth it at the end, my dad always said a seed has to go down before it goes up. So the
Correct.
fact that you planted
Correct.
the seed,
Correct.
you had to go down
Yes.
first, but now you're sprouting and you're flourishing.
Like
We're
that.
grateful for that. So is there anything else that you want to just share with people? Any misconceptions or misunderstandings about your job that you just want to share with anyone, so maybe average civilians will know?
Okay, go ahead.
Well, we as medical laboratory scientists are always working behind the scene.
Yes.
Yes.
So we test blood, we test all the body fluids, urines, and everything, and we help we help a sick person get better by giving them accurate and reliable results. And for me, my job becomes more meaningful because of that.
So you play a pivotal role in discovering the diagnosis
Of
or making a
course.
diagnosis.
Yes, of course, yeah.
Right. Without you
That's
all, we wouldn't
basically
get
it.
it. We
Yes,
wouldn't.
Doctors
basically our
depend
job.
on our result.
Yes.
And then the laboratory is composed of 2 parts. The clinical, which is the blood test and everything, the urinalysis, and the other part is the histology part, which is the tissue, anatomic part, which is all the specimens that from OR after the operation, checking for malignancies.
Oh,
So,
yes.
yeah.
Yeah.
That's
Okay.
our part too.
Wow.
So
Yeah.
we're trying to give them an accurate results so the doctor can help them giving the right medication.
Correct. Yes. Yes.
Well,
That's something.
Yes.
I
Yes.
really want to hear more. I
Yes.
really do, but I guess we have to come to a close.
Yes.
So I just want to thank you for your time,
Thank
and
you.
on behalf
Thank
of
you too.
Charles County and just everyone who benefits from you, I just want to say thank you for your service, thank you for your time, and thank you for your dedication and your sacrifice, because it
Yes.
is not easy, but you did it, and that proves that there's resilience in what
Yes.
you do, and there's knowledge and love in what you do.
And thank you, God.
My
Yeah.
pleasure. Yeah,
Thank
yeah.
you, God.
And thank
Welcome.
you, God. Yeah.
Yes. That's right.
All the glory.
That's right. That's right.
Yes.
So you heard what you heard, and I'd like you to remember, without the ladies you just met, your doctor, the doctors at this hospital, would not be able to make their diagnoses to help you and heal you. So I want you to remember that.